Good afternoon, everyone. My name is Gonzalez, and I will be presenting on LVAS, which stands for Large Vestibular Aqueduct Syndrome. So let's begin. The definition, it's based off of the vestibular aqueduct, which is right in here, this little part. It's a narrow bony canal aqueduct that runs through the skull, connecting the inner ear vestibule to the cranial cavity, hence its name. And my resource was from hearinglosthealth.com. Around 1978, only the vestibular aqueduct was known to be enlarged. Recently, with more research and discovery, they understood that endophalic duct and sac are the enlarged, and that's what causes some of the hearing loss. So, the diagnosis, all you have to have is a CT scan or MRI, and they'll be able to see whether this part is enlarged or not. It often occurs with fluctuating hearing loss. So one of the reasons why I chose this topic was because my brother, he was born premature and he has a lot of medical complications. And around the age of 5, when you go to school, you get your physical, that's when we discovered he was partially deficient in hearing. So he was provided his hearing aids, and I brought in some of what he uses. I didn't actually bring his hearing aids because he uses them, but they basically come in this little cute box, and these are just some of the equipment. So right here, this is where you put the little battery, and it tells you what percent it's on. The company is called Phonak, and then he uses this little instrument to take out the wax because it builds inside the hearing aids, so that's what he uses to clean them out. He does that pretty much every day. And then here are some brochures of what the actual device looks like. I know for older people they have like those little micro ones that they put inside, but given his condition, I think these are the ones that he has to use because these can be altered. So when he goes into the audiologist, she has a machine, and based on his exams, she can change the level of hearing that he may need. So I think that's one of the reasons why he can't use like the little microscopic ones, because these are like very specific. So you could take a look around. Okay, so that's that. I also brought in one of his exam results, just so you could get like an idea of what the exam is composed of. And so it'll show you the actual diagram of where he has most of his hearing loss. He has, I think the left side is worse than the right side, and basically this condition, he has to be monitored every 3 months because it could go up and down based off like if you have a cold or if he had any kind of head trauma, like if he was running and he fell, that could have caused some hearing loss. So he has to visit the doctor often. He also has an ENT specialist. So he has an audiologist, an ENT, and then he has all his other primary doctors. So treatment, there is no cure. Like I said, it's a progressive condition. So if you don't take good care of it, it could get worse to the point where a person can become permanently deaf if they have a very severe head injury. So basically, the only treatments is you're monitored, you wear hearing aids. Depending on whether there was a damage to the cochlea, you can have a cochlear implant, and that's for severe cases. Most of that is done when they're very little. They also have some surgical procedures, but it's a 50-50, so it could either make it better or it could make it worse. So it's not very recommended that they go through that. They also will need a lot of speech-language therapy because when you're growing up with that hearing deficiency loss, you can actually pick up proper ways of speaking. So when he was growing up, he had to go to therapy, speech therapy, twice a week, and that helped him a lot. But you'll hear his recording, I have a little recording of him. He's 20 years old now, and he still can't speak properly. He has a lot of problems with that. So he'll be able to hear and tell the difference. This causes a lot of emotional stress. So in a lot of patients, they might end up having depression or psychological disorders as well. So it's correlated to that as well. Like I said, precautions, there's a lot of them. So no head trauma, no sports contact. You also want to avoid the changes in the barometric pressure. So no flying on airplanes, no jumping, skydiving, scuba diving, any of that. Because their ears are so sensitive, it could literally become permanent deaf. So it's a very severe, very serious condition. Here are the images from our books, so you can look at exactly where that part of the ear is. Here is a little girl. She's having an audiological exam, and they're testing to see what percent of hearing they have. So these are another diagram of the inner part of that. And then these are just pictures of him. And then in conclusion, LVAS is a sensorineural hearing loss that progresses over time, but with proper treatment, you can have a full life. You just have to be very careful. And before I'm done, I'll let you listen to the audio. Are there any questions so far? No. All right. 1 second. Okay. Oh, oops.
Hello, my name is Ryan, and I am hard of hearing since I was born. At 5 years old, I got my FM, and when I was 13, Dr. Patel told me I had LVAS. I know sign language to since I was in middle school. Thank you. Have a nice day.
So you can tell the difference that he has a lot of speech problems, and that's also caused because of LVAS. And then lastly, we'll do a fun dynamic. So if everyone can stand up where you are. Alright, so we're going to do a little game just to test your hearing. Alright, we're going to start on this side. And we're going to start off with your favorite color. So you'll say your favorite color, then the next person has to repeat your favorite color plus your favorite color. So it's like a chain. And then whoever can't continue the chain will sit down. And then whoever remains will be the winner. Got it? Alright, you start.
Gray. Gray and fuchsia.
So you have to say gray and then yours.
You said gray or green? Gray. Green? Yeah. Green, fuchsia.
Okay, next.
Green, fuchsia, red.
Green, fuchsia, red, blue.
Green, fuchsia, red, blue, pink. Red, green, fuchsia, red. I know. Is it pink? Blue, pink, red.
Next.
Green, fuchsia, red, pink, blue, pink, camo.
Oh no, I didn't.
So you two are out. Alright, so you two are out. Okay, next. So now we're going to do a different topic. Favorite sport?
Basketball. Basketball.
Basketball, football, volleyball.
Basketball, football, volleyball, football.
Anything dangerous.
Shannon.
Scuba diving, parachuting, snow skiing, snowboarding,
Oh,
motorcycle.
really?
Oh.
No, you're supposed to follow
A
the chain of
favorite sport,
events.
meaning singular.
Right.
Just do school. You gotta remember her. Skydiving.
You gotta repeat all of ours plus yours.
Football, basketball, you named all football, basketball, football.
Basketball, football, volleyball, football. Okay, you're out.
Alright, you're out.
Skydiving. Oh, you picked that one? Okay, so basketball, football, volleyball, basketball, skydiving, and basketball game.
Basketball, football, volleyball. Basketball.
Okay, alright. So we're getting down. Okay, next, favorite food.
Pasta.
Pasta, macaroni, cheese.
Pasta, macaroni, cheese, pasta, macaroni, cheese.
Macaroni, cheese, pasta.
Pasta, mac and cheese, pasta, pizza.
Alright, favorite president.
Oh, I didn't do that.
Yeah.
You gonna have to change study on that.
Right. Obama. I want to lie to see the other presidents, Obama.
Obama.
You guys are supposed to change the subject. Or to change the name.
Everybody's saying Obama.
Okay.
Yeah, that was a bad one.
Alright, favorite anatomy.
Oh, mama, that's even worse.
Favorite anatomy part?
For a man or a woman.
Alright, well now you get the gist of like hearing is very important, and when you can't hear correctly, it impairs your ability to learn, ability to talk, and it really affects your lifestyle. So just appreciate that you guys can hear normally, and whenever you do encounter someone with some kind of hearing problem, just make sure you give them the benefit of the doubt. If they say, "Oh, I can't hear you," talk a little louder, and just be aware of there's a lot of hearing conditions, and this is just one of them. So, thank you.